Hi, my name is Casey Pyle. I'm married to my high school sweetheart, who I have 3 boys with. My sons, Brendan, Tristan, and Jordan, are ages 6, 12, and 13. Just a little bit about me. I've been a paramedic at Cypress Creek for the last 15 years now. I'm an EMS educator, and now I seek to earn my degree to facilitate transferring to the next phase of my EMS career. I promise I'm going to try and keep this under, or not under, but at the 3 to 5 minute mark. I'll do my best. Okay, so let's talk about the emergency medical services system, the structure in which I currently practice at. Now I need to give a little disclaimer up front. I was recently laid off in November from Cypress Creek EMS. I spent all 15 years of my EMS career there under the model CCMS had while I was employed there. And that's the model that I'm going to be using for this report. Another disclaimer, if you look up CSC EMS's status today, you will see that they have recently switched to a new business model. However, the business model that I'm using is commonplace here in Texas. For these reasons, you may hear me use the past tense from time to time as things have changed and very recently changed. So Cypress Creek EMS was a private, nonprofit 501c3 company. CCEMS was funded via taxpayer money allocated to CCEMS by the commissioners of the Harris County Emergency Service District number 11. ESD 11 is approved by the Texas Department of Rural Affairs. The model that CCEMS would fall under would be the public utility model. The public utility model is an EMS delivery system where the municipal government purchases EMS services from a private provider, Cypress Creek EMS, and the municipal government retains control and oversight of the services. So let's talk about the origins of the EMSS, Emergency Medical Services System, and kind of touch on the strengths and weaknesses a little bit. The Emergency Medical Services System Act came about in 1973, and it was designed to provide funding for the creation of more than 300 EMS systems across the nation, as well as it also facilitated setting funding aside for future planning and growth. Some of the strengths of the EMSS is their collaboration. They're bringing together a collaboration of EMS professionals across the nation. Few of those collaborative efforts are help to develop and improve like staffing, training, communications, education, and data collection. Another positive result, which stems directly from EMSS, is the removal of geographical barriers as agencies work together for the betterment of the patient now. There are some weaknesses, particularly around the political construct. Because of the political construct, the system remains relatively fragmented because it's made up of a multitude of agencies, and the multiple agencies being responsible for EMSS as opposed to a single agency kind of creates some difficulties with the standardization, national standardization of regional and local EMSS systems. State and local entities are often criticized for resisting further standardization in favor of maintaining local control. It's the whole state versus the nation thing. So with that, we can talk a little bit about interagency agreements and the organization's role as a resource during major times of disaster. So interagency operations are agreements, mutual aid agreements, or like automatic aid agreements that are designed to fill the need for critical resources during times of like high demand for services. Likewise, the role of EMSS in disaster response continues to evolve and expand. It It's not uncommon to see agencies go in together and choose to buy different pieces of equipment so that a general region can all utilize those pieces of equipment. An example would be our region has the Ambus, which is a massive bus that is meant to transport 10 to 15 patients. And it's housed out of a certain agency, and another nearby agency has off-road capabilities and so on and so forth. The EMSS structure, it may influence like specific role and scope of interagency responses. So again, where they're located and what their capabilities are and specialties are within the region. Mutual aid agreements between departments and agencies, they really allow for appropriate allocation of regional resources during disasters, disaster events, serving the greater good of the public as a whole. So the elements of the EMSS structure are first response and transportation of the patient. First response in my agency and in my region is provided by law enforcement, fire department, and the EMS agencies, of course. We all work together to take care of the public. Regardless of who gets there first, EMS is ultimately going to arrive and either take over or continue ongoing care on scene, and then during transportation to the hospital by ground. In some situations, medical helicopters, air medical, may be utilized for transportation of the patient to a specialty resource center. Accreditation. Let's talk a little bit about accreditation and the impact that it has on organizations. So organization accreditation, like the different bodies like the Commission on Accreditation of Ambulance Services, they provide a process for validating patient care, operational policies, system policies. They facilitate credentialing and accreditation, which helps avoid legal liabilities through demonstrated and defined commitment to EMS best practices. Additionally, the emerging importance of higher education for pre-hospital providers will definitely play a role in the future in helping. And these accrediting bodies, like Commission on Accreditation of Ambulance Services, facilitate that the addition of value to these higher degrees. So let's talk about the political aspects, local, national, that influence the development of EMSS structure here that I participate in. So this is kind of complicated and complex, and I have narrowed it down to a much smaller list, but just know that this is has been a very complex situation. But in my agency, politics have played a significant role in the birth of the agency and the past 45 years of service from my agency, or my old agency, and ultimately the removal of Cypress Creek EMS from the 911 services. So in the beginning, a group of citizens from the community got together. They lobbied for the creation of an EMS service. After one of the local citizens, a man died from a heart attack while waiting for an ambulance that ultimately never came. Over the last 45 years, CCEMS provided service to the community. In April of last year, the ESD 11 commissioners decided to terminate the CCEMS contract in favor of standing up their very own EMS service. So, needless to say, throughout the past 45 years, politics has played a significant role in the birth, the maintenance, and ultimately the end of CCEMS providing 911 services to the community. So some of the pros and cons of political influence in the EMS structure. I think some of the cons obviously would be, people lobbying and for maybe the wrong cause. That would be a very obvious con. But politics can serve as a positive, as a vehicle for crafting new objectives and new policies, advancing EMS into the future, and really driving the standards of care up across the nation. So let's discuss the role of program medical director. So the program medical director, they provide medical oversight, including the authority to approve patient care protocols. They certify or decertify EMTs and paramedics. They manage the quality assurance programs, oversee and manage the entire EMS program as a whole. PMDs is essentially influence an agency by identifying, or also influence an agency by identifying and training EMS personnel on EMS best practices. So in Texas, we have one of the largest resources for EMS agencies are in Texas, one of the largest resources for EMS agencies are the formation of the regional advisory councils. My area is supported by the Southeast Texas Regional Advisory Council, or CETRAC, who supports local agencies with resources from education, supplies, networking, and, of course, disaster preparedness. CETRAC is a non-governmental organization that influences EMS by working to establish standards of care, protocols for consideration, adoption by area hospitals, EMS agencies, and other providers. Some other examples of non-governmental organizations would be National Registry of Emergency Medical Technicians, the National Association of EMS Physicians, and the Commission on Accreditation of Ambulance Services, or CAS. So some of the emerging legal, political, and regulatory trends that I see, the two biggest would be community-based healthcare management, which is fully integrated with the overall healthcare sample system. A good example of a community-based healthcare management, or a good example of how this is going to be an ongoing trend, an ongoing impact in EMS, is the ET3 model, which was approved and rolled out in the beginning of this year. We're also seeing trends toward credentialing for EMS providers. Credentialing is generally administered by non-governmental entities, which determines a set of predetermined standards that's approved by a particular service. So CAS, National Registry is another one. Almost every state now is utilizing National Registry as their main credentialing spot. And I think that there's going to be additional credentialing, additional credentials introduced into the EMS systems market that is going to really fine-tune the specialization of EMS personnel. That is all I have for you. I apologize for having to grab a drink of water in the middle of this video. Thank you.